Adults, young and old, know the importance of providing vaccinations for their children and grandchildren. Many older adults may not realize the importance of vaccinations that are recommended for seniors that can prevent a life-threatening illness. Without these vaccinations, millions of older adults are at risk of being hospitalized, developing the effects of debilitating disease, or even death. Federal data shows that over the past 15 years, the vaccination rates for older adults have remained the same and do not meet national goals. The Centers for Disease Control and Prevention, the CDC, recommends the following 4 vaccines, which include the flu, pneumonia, tetanus, and shingles vaccine. I will present the vaccination rates for older adults, reasons why seniors may not get immunized against serious disease, and what efforts are being made to increase vaccination rates for our senior population. There are many challenges public health officials face when addressing older Americans getting important disease prevention vaccines. 1 in 3 seniors do not get the flu vaccine, which is recommended on an annual basis. 4 in 10 seniors do not take a pneumonia vaccine, which is a one-time vaccine recommended for people 65 and older. Nearly half of older adults are not up to date on their tetanus vaccine, which is recommended every 10 years. The shingles vaccine, approved in 2006, has the lowest acceptance rate by older adults despite an estimated 1 million cases of shingles reported each year in the United States. There are multiple reasons for adult vaccination rates remaining stagnant over the last 15 years. Unlike immunizations that are required for children, adult vaccines are not required. Vaccines for flu and pneumonia are not always effective in preventing illness. Copays for vaccines, such as for shingles or tetanus, may be costly. Many primary care physicians aren't making vaccinations a priority during routine care visits. Many adults simply don't know what vaccines they should have due to lack of information and education. Efforts are being made to improve vaccination rates among older adults. Many clinics and hospitals are now offering drive-through flu shots given to people in their cars. Allowing other staff members, such as nurses and medical assistants, to review patients' records and provide vaccines as needed. Public health officials say doctors need to recommend vaccines more often. As a registered nurse for 32 years, I would of course like to see a 100% compliance rate for senior immunizations. Although there has been little to no growth in immunization rates for seniors in the United States over the last 15 years, health experts report efforts are being made to educate and provide much-needed vaccines to this population. The federal government has set a goal of 90% immunization compliance for seniors by the year 2020. Vaccination rates for seniors have remained at about 65% for the last 15 years. There are multiple reasons older adults do not get the Centers for Disease Control and Prevention's recommended vaccines. Providing education regarding vaccines during routine doctor visits and offering vaccines at little or no cost to the patient could help improve vaccination rates. Increasing vaccination rates among older adults could prevent illness, costly hospital admissions, or even death.